morning, afternoon, depending on where we are in the country or world. Thanks for having us. I'm Dr. James Cireddu. I'm a cardiologist in the Cleveland, Ohio area. I'm a medical director, also system director of nuclear cardiology, University Hospitals of Cleveland, an associate professor with Case Western Reserve. I'm joined by Jasmine Clough, one of our research assistants for VPexam and our research on this virtual care platform. We thought it'd be interesting to talk about some of our recent research utilizing this type of technology. The real key to VPexam is to be able to bring physicians to the bedside, especially in underserved communities, to better tailor therapy around heart failure. And a large component is focused on the various technologies. This is a decompensating patient. We can use things like home blood pressure cuff scales, smartwatches to send alerts to physicians when they're decompensating, their pulse ox is dropping, their weight's going up. And then we can use physical exam data to optimize their therapy, and we'll run through some of the tools that we have with VPexam. But this is the physician portal. And we can do real-time virtual care. This is often in nursing home care agency kind of settings, where usually a cardiologist is not going to be able to have the time to go see these patients. And that's kind of where most of our clinical studies have focused. It's a flexible platform where the patient can be seen by a nurse, a medical assistant, or their own family member, and use augmented reality training to guide them through the process of performing a full physical exam for heart failure. We are device agnostic, meaning we can essentially tap into any kind of home-based devices, smartwatches, scales, things like that. And the question is, why heart failure? Well, it's an interesting market. It's very common. It's the leading cause of hospitalization in the US, age over 65. And about a quarter will be readmitted within the first month, and half will be readmitted within 6 months. So also a very expensive problem that we're dealing with. So, the concept for the technology is to partner with cardiologists and healthcare systems and connect them to the platform so they can follow their patients on discharge from the hospital. Excuse me. This is one of our common problems in heart failure management. The patient comes out of the hospital and we see kind of this problem where we can't see them in clinic soon enough. By the time they develop symptoms, it's usually too late and they end up getting rushed to the emergency room. So, and then they may get admitted to a different hospital and discharged to a different nursing home. And these are common issues that we're dealing with that this platform improves continuity for. So we'll dive into this a little bit deeper, but this is a home care nurse using it on a sample patient and assessing JVP, lower extremity edema, performing a full heart and lung examination with a Bluetooth stethoscope with an EKG. This is the physician review portal that allows physical exams to be reviewed similar to the way we look at echocardiograms, and then doing a real-time virtual encounter with the sample patient here. So the key is it gives patients and their families and the nursing home and the home care agency direct access to a physician at any time. We can also pull in all the smart health data and use that to set off alerts, again, showing us when they are decompensating further upstream and then seeing them relatively quickly. We'll dive a little deeper into some of the augmented reality guidance, but this, is a fairly significant step above what we can do with regular telemedicine. The remote patient monitoring from consumer wearables is a big value to our care, but usually we're missing most of the physical exam data. And that being added back in has added significant clinical improvement in our care using this kind of model. I'll turn it over to Jasmine to discuss some of the components that go into VPexam virtual care.
So to review some of the key components of VPexam and augmented reality guidance, jugular venous distension is an indicator of right atrial pressure, which is typically elevated in heart failure. The augmented reality guidance and instruction assistant in routine patient positioning and proper camera orientation. The platform is very user-friendly. Originally, the focus was on nurses and medical assistants, but even patient family members can act as users. Typically, virtual physical exam uploads are completed 5 to 10 minutes prior to real-time virtual encounters. The platform is also useful for evaluating lower extremity edema. AR guided instructions guide appropriate position to apply pressure in the pretibial area as an alternative sign of more chronic right side heart failure. Next slide. VPexam is agnostic of devices and can integrate a variety of medical devices. The most common for cardiology use cases is an Echo Duo Bluetooth stethoscope integrated with ECG capabilities. The augmented reality instructions guide users through appropriately positioning the stethoscope for a full heart and lung exam customized by the physician user. Auscultation of the heart and lungs, helping to identify murmurs in valve disease, fluid in the lungs, or crackles, and abnormal lung sounds such as wheezing and rhonchi. Sounds can be listened to and PSG can be visualized. The integrated ECG allows for detecting abnormal rhythms like atrial fibrillation that is common in heart failure.
All right. Well, thank you. All right. So, yeah, this has mainly been an overview of some of the value of the platform. We've had a series of publications, mainly out of the Cleveland and Northern Ohio area, looking at using this combination of technology on patients coming out of the hospital system. We have about 12 hospitals across our healthcare system, and we use this at two community-based hospitals, and we looked at all patients being discharged from the hospital. They had BNP levels above 300, but it was both preserved and reduced ejection fraction patients. And we really focused on patients at highest risk for readmission, especially those who've been readmitted in the past. And we utilize this platform to follow them within typically the 5 to 10 day window after discharge from the hospital. Some of the biggest findings from our work has been that the physical exam data significantly changes the way we interact with patients and we modify medications. A lot of the time with routine telemedicine, you don't have the clinical confidence to adjust diuretics and antihypertensives, but the combination of remote patient monitoring combined with physical exam data gives you a lot more clinical confidence to make these kind of adjustments. Not an enormous cohort, but in our cohort, you can see this graph of hospital readmissions, and it fluctuates. And as a medical director, you pay attention to these fluctuations. You put programs in place to try to reduce readmissions. But you can see some of our historical data for readmissions was varying between the 10 and 40% range. And this is also during COVID, where we're having additional issues. But if you look at VPexam, it was initiated in these hospitals, and by month 3, 4, 5, and 6, our readmission rate had dropped to 0% for these hospitals. So there's over 40% relative risk reduction in 30-day rehospitalization. And we also looked at a secondary outcome of 30-day all-cause mortality, and actually reduced over 56%. So we're actively doing additional research to look at this on larger patient population pools, but especially for these patients going to home care who are homebound, and those going to nursing homes, a powerful tool Also, the compliance with follow-up was 100% throughout the study, meaning we did not have patients kind of lost to follow-up. There's a communication tool called a partner portal that communicates actively with nursing homes and home care agencies to make sure the appropriate patient files with the appropriate physician or nurse practitioner on the correct day and time. And there's also zero technical errors and over 500, now over 700 devices. And this was all deployed in under a week using app-based approaches. And both the patient and nursing satisfaction was extremely high. So, building on this technology, I think it's a nice technology, especially for physician innovation and disruptive technology. The Heart Rhythm Society, HRX, within the last 2 years, did provide VPexam with a breakthrough innovation in cardiovascular digital health. And last year, the Digital Health Hub out of UCSF gave VPexam a best-in-class next-generation telemedicine award. So, I think on the clinical side, there's a lot of merits to this kind of technology. That unfortunately, there's still a lot of patients suffering from heart failure who are not being seen regularly by cardiologists and do not get guideline-directed therapy because of it. And again, I think the physical exam is an important addition to telemedicine. And one of the reasons I think telemedicine has been moved away with since COVID was really bringing it in to the front lines of use. The other side of this is the financial motivations that healthcare systems and physicians have to look at, and that's financial and billing side. So when you look at adopting technology, sometimes you can improve quality, but it's not going to improve financial outcomes. But the interesting thing is by adopting technology, there are already existing CPT codes. One side of things is higher complexity telemedicine and virtual care visits. Another side is reviewing and interpreting remote patient monitoring data to improve patient outcomes. And some of the ones that are becoming more prevalent are transitional care management, which VPexam has a lot of utilization for, as well as chronic care management, especially in other kind of cardiac conditions, including atrial fibrillation and hypertension, also in pulmonology, where the physical exam is also important. We use it for COPD and pneumonia as well. So we've been getting additional partnerships based on that as well. And the other side of this is building more of a robust local virtual care based community program where the healthcare system can connect to the home care agencies and the nursing homes to improve outcomes and better connect them to the hospital system for better longitudinal care. These are some of the larger things. When I come back to motivating some of our stakeholders, it's a combination of health systems can appreciate that the average readmission costs over $15,000, and there's also penalties from CMS. The other side are providers who have to be attentive to billing and RVUs as typically as a way that we're measured for our productivity, regardless of health system. And then there's also the nursing homes and home care agencies. The biggest value is really improving outcomes. When you're deciding who you want to partner with as a hospital system, having lower readmissions is key to sending your patients to those kind of facilities. So we can help facilitate specialized care in these facilities that normally would not go there. But even the cost and risk of transporting patients, an ambulance, and the nursing costs adds up, and also the risk of bringing back infectious diseases, including influenza, COVID, and that side of things. So, within the cardiology space, we're excited to kind of expand utilization of this platform to improve patient outcomes with hospital systems throughout the United States. I know we're running behind, but if anybody's interested in reaching out to me, always happy to talk. This is my telehealthcare solutions. I also have a profile with University Hospitals of Cleveland, but always happy to discuss further virtual care and kind of new frontiers on that side. Thank you.